Hi, my name is Ashley Gonzalez. I'm a student at Lamar University. I'm in the capstone course, Nursing 4580 Practisium Synthesis of Professional Nursing. This will be my presentation for my capstone and 5-year plan. Okay. In this presentation, I'm going to give you a little bit about myself, and I'm also going to talk about the learning objectives and my 5-year plan with my nursing career. So here it goes. Again, my name is Ashley Gonzalez. A little bit about me. My educational background, I went to San Jac. I was in the dual credit program, and so December 2016, a couple years out of being out of high school, I graduated with my Associate of Life Science and General Studies in December 2016. Also, I graduated with my Associate of Applied Science in Nursing, or ADN, in June 2017 from San Jacinto College. I graduated with a GPA of 3.75. Currently, I'm in the Baccalaureate program at Lamar University, and I'll graduate in December of 2019. Yay! A little bit about me professionally. I've been a nurse about 2.5 years on an acute inpatient med-surg tele unit. I've also recently gained experience of administering chemo on an inpatient and outpatient basis with my facility. Also, I have a little bit of inpatient rehab experience in the acute setting. Over the course of these 2.5 years, I have 1 year charge RN experience. I currently hold BLS, ACLS, getting my chemo certification with my facility, and I am EKG certified. Recently, I gained a professional honor and I got a Daisy Award this year within the past 2 weeks. I'm super excited about that. So I feel like it's like a gold standard of nursing, and when I'm having those bad days, it helped me realize, I'm doing the right thing, and it's recognized. So I'm real happy about that. I was very emotional about that. Also, I am on some committees at my current facility, which is Houston Methodist, the Clear Lake location. I'm on the shared governance for my unit. I'm a member, only a member. I'm also on the skin committee. I'm a skin champion. I recently joined this one. I've only been with Houston Methodist since about July of 2019. I'm also a unit Foley educator and Foley champion. And I'm also a new member to the Research and Innovation Committee. The facility I'm at for Houston Methodist is a Pathway to Excellence organization, so we are working towards getting the magnet status there and becoming magnet designated like the main campus, Houston Methodist, HMH. A little bit more about me. I'm 25 years old. I've been with my boyfriend for about 2 years now. I don't have any kids. I've lost an extreme amount of weight. I've lost over 120 pounds. Still going, still chubby, for lack of better words. I'm bilingual and I am biracial. I speak Spanish, and I'm half Hispanic and half Black. I am going to go into the learning objectives for the Lamar University Baccalaureate program. Okay, the first learning objective falls under the humanity and society construct. Learning objective number 1 was practice a safe and effective holistic patient-centered care to a variety of patients/clients and multiple settings from a global perspective by incorporating theories and evidence-based findings. I accomplished this learning objective and course Nursing 4540, nursing practice, care of communities. I believe I accomplished this through the assignment, the community-based service log, civic pride and diversity assignment. Um, on my community-based service learning project, I did I spent some time and volunteered at the community children's shelter at the harbor. It's an organization I have worked with in the past, like in high school, with my former boyfriend. I explored how I could help my community, my actual community, like where I live. Um, my ex-boyfriend's family was a host family, and I was able to go interview them and talk to them about different things, as well as a family friend whose um, mother and father are the former directors there, and talk with them and spend some time with the children there. I don't get to interact much with children, so to be able to get to know a different age group, get that experience. I was able to take that into the clinical setting to my patients who they always don't come from a privileged background like I do. They come from a disadvantaged background sometimes, most of the time. And I was able to provide better care to my patients and nurse my patients because I was able to nurse their family. And I had a better understanding of what was going on. I believe I accomplished this goal 100%. Learning objective number 2 was supports patients/clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I believe I accomplished this. I don't believe, I know I accomplished this in Nursing 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. I accomplished this through the assignments of the Practisium Reflections 1, 2, 3, and 4. I believe practicing the Practisium assignments for 1 through 4 helped me achieve the objective by taking a patient in the clinical setting I was able to work on promoting wellness. I chose a patient of mine with a traumatic brain injury that had a fall and related that also to a personal memoir. I was able to develop a teaching plan and a plan of care for that patient that was personalized to that patient. I believe I accomplished this 100%. Learning objective number 3 falls under the lifespan and health continuum construct. Learning objective number 3 was evaluates patient-centered care for patients/clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. I believe I accomplished this in Nursing 4620, care of patients with compromised health states, with assignment Practisium Reflections 3. With Practisium Reflection 3, I was able, like I previously stated, to develop a personal plan of care that was designed for the needs of the patient. I assessed during the time I spent with the patient, and I had the actual opportunity to implement this while I was at work with my patient. And it actually turned out great, and the patient never came back to the rehab unit. I did the follow-up calls, and she was actually able to take the interventions and things that we talked about and apply it to her daily life, and has been successful. I believe I met this goal at 100%. Learning objective number 4 falls under the evidence-based practice and clinical reasoning construct for the program. Learning objective number 4 was synthesize clinical and judgment and nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I accomplished learning objective number 4 in Nursing 4550, Nursing Practice Leadership and Management in the Healthcare System. I accomplished this on the Practisium assignment, Clinical Application. I was able to pick a national patient safety goal, um, and design a fall prevention program after talking to my unit leader. Um, and I designed a personalized fall prevention program that I was actually able to enforce on my unit. And before I had left that facility, the research was trending that, the research project was trending that with those specific fall interventions, um, we were seeing a gradual decrease in falls, and everybody was really on board and supportive of what we were doing before I left. I met this goal at 100%. Learning objective number 5 falls under the patient-centered care construct. Learning objective 5 is employ safe, effective patient-centered care using theories and evidence-based finding in collaboration with patients, clients, and members of the interprofessional, and intra-professional healthcare team. I accomplished learning objective number 5 in Nursing 4540, Nursing Practice Care of Communities, and the assignment for Community Project Disaster Preparedness, Practisium 1 through 5. In this Practisium, I was able to identify an at-risk group of patients, research and do all the legwork, and develop a preparedness plan catered to that group. And this is a group that I frequently work with on my unit. So I have been able to take this and also apply it to the clinical setting. I believe I met this goal at 95 to 100%. Learning objective number 6 is differentiates multiple role dimensions and practices within the ethical, legal, and regulatory parameters when caring for patients/clients as a member of the interprofessional team and interprofessional healthcare team. I accomplished this in the course Nursing 4321, Nursing Theories and Online Education. I accomplished this with the assignment Differential and Essential Competencies, or the DEX paper. I was able to successfully identify with that assignment what competencies that the Board of Nursing published to guide nursing education, and kind of have it unified so all nursing programs are streamlined and are putting out the best possible nurses. I also believe I accomplished this in the current course, Nursing 4580, since this is a professional nursing with discussion board on Baby William, because there I was able to differentiate where nursing was lacking, where the doctor was lacking, and also where the pharmacist was lacking in that discussion board. And I was also able to identify legal ramifications that could have happened, and identified evidence-based ways that we could, or the nursing team in that discussion board and that case study could have taken different actions to avoid what happened with baby William. I believe I accomplished this 100% twice. Learning objective number 7 falls under the professional roles construct. I accomplished this. Learning objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. I accomplished this in Nursing 4540, Nursing Practice Care of Communities. I accomplished this on the community-based service law learning, civic pride, and diversities initiative assignment. I was able to actually identify an organization within the community and really get involved, and I'm still considering being involved with the organization after nursing school is finished for my BSN, because it's really helped me get find a sense of pride and a sense of community and a sense of being. I believe I accomplished this 100%. Next, we are going to talk about my 5-year plan. So this year in 2019, I plan to graduate with my BSN. In 2020, I plan on obtaining my board certification in medical surgical nursing. I plan to become board certified. The second half of next year, I plan to transfer to a case management role um, and begin working on the administrative side of things. I want to try and get at and hold as many different roles in the hospital as I can, so I'm a real well-rounded nurse and I know what I'm talking about when I'm talking about it. In 2021, I want to begin a MSN program in administration or education because I really feel like, if I want to make some changes, I should get into administration. But if I want to groom the next generation of nurses and put out competent nurses, and really just affect, the culture of nursing like I want to, education would be the route for me. And I've been leaning more towards that. In 2022, I plan to obtain my board certification in case management. And also personally, I plan to LLC a business related to wellness, and actually jumpstart and open that business. I'm not sure right now if it'll be related to a fitness, it'll be a meal prep thing, if it'll be a whole life nurse type of thing, wellness for nurses. So I'm still, brainstorming that, but by 2022, I plan to know what it is and execute it. In 2023, I plan to graduate with my MSN and begin teaching at a community college if education was the route I decided to go. And I also plan to dedicate myself to my own business since I will be done going to school for a while, and I'd want to start a family. So, again, here are my references. My name is Ashley Gonzalez, and thank you for your time.